Imagine you are a 22-year-old Ethiopian woman who grew up in a small village. You went to school up to 4th grade, but then had to drop out to help on the farm so you could support your family. One of your friends from the village had left several years earlier to work in a nearby town as a waitress. When she came home to visit her family, she had new clothes and talked of a better life. She suggested that you follow her to the town, and she would introduce you to a friend who could find you a job. Your family thought it was a good idea. Your friend introduced you to a broker who found you a job as a waitress. Many of the men who came to the cafe flirted with you, but you kept to yourself. The other waitresses told you to wisen up. To afford living in the city and send money to family, you need to supplement your meager income. You started dating a man who was always nice to you, giving you big tips, promising you a better job, maybe even getting married. Coming from a village with little education, you did not know you should use condoms. Anyway, this was different from other women working in the cafe who dated several men at the same time. This kind of story is often heard along the transportation corridors of Ethiopia, where transactional sex is common.
We think transactional sex, commercial sex, and low condoms are important factors driving the epidemic in development corridors or in transportation corridors. Transactional sex is related with low use of condom. Most women will not be able to negotiate, to ask to use condoms.
The spectrum of transactional sex includes, on the one end, commercial sex work, where there is an immediate exchange of sex for money, to other ends of transactional sex where the negotiation is often unspoken. Transaction, a USAID PEPFAR-funded program, addresses the spectrum of transactional sex with the goal of reducing HIV and sexually transmitted infections.
We have prevention activities, we have care and support activities, and at the same time, HIV counseling and STI services through private health facilities. The program is expected to build the capacity of 10 local NGOs.
The program works in 120 towns nationwide, targeting most at-risk populations including commercial sex workers, waitresses, truck drivers, daily laborers, and people living with HIV. Many of the people reached in these groups are young women and youth. Transaction's first step in creating demand for its program is to work with community-level HIV/AIDS committees. They talk to gatekeepers such as brothel and bar owners and convince them to allow Transaction to come in and talk about HIV with their employees. HIV/AIDS committees are coordinated by the government's HIV/AIDS prevention and control offices. Transaction uses a peer-led approach to reach people. Peer leaders, or members or past members of one of the priority groups, visit and conduct discussions in brothels, construction and transport work sites. Peer leaders follow a structured program and provide beneficiaries with information, condoms, and vouchers. The vouchers allow them to get free testing, counseling and treatment for HIV and sexually transmitted diseases. The peer leaders help beneficiaries create self-help saving groups so they can save money and reduce vulnerability to risky sexual practices.
እሺ ስለ አባላዘር በሽታ ነው የምንማረው ዛሬ ይሄንን ስዕሉን እያያችሁ ስዕሉ ይታያችኋል አይደል
በደንብ እየተጠያየቀን እንወያያለን ሰፊ መድረክ አለ ደስ በሚል ሁኔታ ነው የምንማረው ያንንም አማርበታለን በቃ እሷም እንደ አስተማሪ ሳይሆን ከኛው ጋር እንደተሳታፊ ሆነ ጥሩ ትምህርት ትሰጠናለች ካሁን በኋላ ይዤ እስካሁን ከሰራሁት ምንም ያስኩት ነገር የለም ካሁን በኋላ ግን ከዚህ ህይወት መውጣት እንደምችል የማንንም መገዛና እንትን ሳልፈልግ ሳልጠብቅ የሰውን እጅ ሳልጠብቅ ራሴ ከምሰራው ላይ ነገር ቆጥቤ መውጣት እንደምችል ማለት ነው ይሄንን አግኝቻለሁ
Transaction supports HIV and AIDS committees to organize community dialogue sessions. These help beneficiaries understand and discuss the gender-related norms that lead to community acceptances of transactional relationships. Transaction has established a network of private sector clinics and drug retail outlets where beneficiaries can access STI and HIV services using vouchers. Training is an important part of improving service delivery. Effective health workers can now treat sexually transmitted infections initiate counseling and testing, as well as run effective businesses with a high level of customer satisfaction.
ክሊኒኩ ደከመኝ ሰለቸኝ ሳይል በትርፍ ሰዓት ጭምር ማታም ቀንም በምሳ ሰዓትም ቢመጡ እነኚህን ለዚህ በሽታ ተጠቂ ናቸው የሚባሉ ግሩፖችን ትብብር እያደረግን ያለነው እስካሁን ድረስ።
በአሁኑ ትሪትመንት ላይ ጥሩ አካሄድ ነው ያለነው። እኛም ደግሞ ጥሩ አቀባበል ነው፣ በፍቅር ነው። ሚስጥራቸው ሚስጥር አድርገን በወንድማዊ በእህትማዊ አገላለጽ ሁሉ ነገር አስረድተን እንሰጣቸው።
Testing positive for HIV is difficult news for anyone. Our project ensures that when a person is tested positive, they have immediate access to care and support. There are lay counselors in each of the network clinics. The counselors who are HIV positive themselves share their experiences of living with HIV and provide ongoing counseling. Transaction is implemented by 10 local NGOs and 117 HIV/AIDS committees. These groups get support to build their capacity to reach and serve most at-risk populations. Transaction is breaking the silence around transactional sex.
Our goal is making sure that we're contributing to the national HIV effort in terms of reducing the transmission of both HIV virus and at the same time sexually transmitted infections.